Hi there, I'm Dr. Kristina Tansavatdi and I'm a double board certified facial plastic surgeon. I specialize in deep plane facelift and necklift surgery, and in this video I'm going to discuss whether it's safe to remove a portion of the submandibular glands, which I do in cases where there's a heavy neck or there's visible loss of contour where you can't even see a jawline definition. And let me discuss with you what are the risks of removing a portion of the submandibular glands and whether it's safe. I will tell you that it is a safe procedure. I've been doing this for many years, and I will tell you that the glands are important to producing saliva, but they are not the only glands that produce saliva. The second part of it is that the glands lay in a position, if you do know your anatomy and you're seeing a facial plastic surgeon who specializes in doing these procedures, they know the anatomy of the neck, they know where the facial nerve should lie and how to protect that nerve so you don't get an injury. The gland usually lies a little bit in front of and away from the nerve, and there's a portion of the gland that we remove that's visible in the neck that will improve your chance of getting that smooth, beautiful jawline without putting risk to the nerve. One of the other risks that we talk about besides facial nerve injury, which I've already discussed with you, is really low as long as we're staying where we need to be. The second risk that I talk about is a salivary leak or fistula, meaning that the gland can spew out saliva production into the neck. And hence there's a reason why there are certain things that I do to minimize that risk or minimize the swelling, and that is to do a Botox injection at the time of the procedure where the gland is partially removed so that we reduce that saliva production while you're healing. Another is putting a drain so we can monitor the output that's coming out and see if there's any potential that saliva is in the drain output. And another way is to cauterize that gland really well and control any bleeding, any production from that gland when we're removing a portion of that gland. So that helps to reduce the risk of the salivary leak into the neck. And the other thing that I get questions about is whether the gland needs to be removed at all. Well, in another video, I'll answer that question on whether the gland needs to be removed or not. So tune into that video, and you can find me and more of my videos at Facelift Expert. Thank you.